Thank you and welcome everyone to today's webinar. The interface features your telehealth solution must have in behavioral health to succeed. We all want your behavioral health organizations to succeed, and we wanted to cover many of the different features that Med has to offer, and that we believe that all telehealth and patient engagement platforms should have. Today, my name is Vladimir Negron. I'm the Senior Product Marketing Manager at Mend, and today I have with me JD McFarland, Solutions Architect. As far as agenda is concerned, we're going to be going over three key areas today. We're going to start off talking about some critical pieces that telehealth features and telehealth behavioral solutions should include. We'll go over a live demonstration to allow everyone to see a brief walkthrough of some of the most popular features that are on the Mend platform, and a Q&A portion to allow anyone to ask questions, and we'll answer them as we go through today's webinar. Feel free to use Zoom's fancy Q&A box at the bottom and punch in the questions that you want to have answered. Also know that today's webinar recording and deck will be shared to everyone who's registered using the email that you registered with. So don't worry about if you miss something, we'll be able to send that over to you. So let's start with some of the key components that your telebehavioral solution should include. There are going to be many things that JD is going to go over during the live demonstration, but a few of the key components. Easy to use. It's important that all the features are easy to use for your patients, for yourself or other providers, and your staff. Ultimately, this is going to save you time, your staff time, and effort so that you can focus more on patient care. The features should also be integrated. If your platform doesn't seamlessly integrate with your EHR, doesn't seamlessly integrate with other components, and it's not serving both your virtual and your in-person patient visits, then it's time to also look elsewhere. Secure. Patients and government regulators demand that patient health information be confidential and secure. So Mend makes sure that we can deliver on that promise. If your current solution does not, then you should also look elsewhere. And powerful. The way we're going to define powerful in this session is it customized to your needs, and is it ever evolving? Your telebehavioral solution should solve your current needs. Yes, it should be powerful enough to do that, but that's a minimum. It should be constantly improving to solve future needs, whether they're known or unknown. And that's something that we'll talk about in a little bit. So let's start with the live demonstration. I know that JD has a lot to cover. So please be aware that this isn't going to be extensive, but it will touch on a lot of the key components and the most common features that you can look for in your telehealth solution.
Hi, I'm JD McFarland, and I'm a solution architect here at Mend. Today I'm going to be walking you through the video visit user interface. The first thing to know is Mend goes to where the clients are, and more that's on their cell phone. So we're going to send the client a text message and/or email letting them know an appointment's been scheduled, and we're going to send them reminders about that appointment up to the time of the appointment. All the client's going to have to do is go to the text message, click the link, and join the visit. If you're working in an integrated workflow, these will get created automatically when you schedule in your EHR. Once the client clicks the link, they're just going to have to enter their date of birth, no passwords necessary. And once again, we can pull this in automatically from the EHR, so no duplicate data entry on the part of your clinic staff. With Mend, we can assign forms automatically based on appointment type, and we can ask the clients to complete them prior to filling out the appointment. We're going to go ahead and click yes and start our form. This form is just a simple PHQ-2 assessment, a quick questionnaire a behavioral health practice might ask every one of their customers at each visit, just to get an idea how they're doing. With the Mend system, if they indicate they're having a problem, we're going to be able to assign a subsequent, more in-depth form, something like a depression screening or a PHQ-9, so we can get some more information on that client and get it delivered back to the practice before the time of the appointment. That's going to give your team better information with which to serve that client. Once we complete that form, we're going to move into our video performance test. You can see my partner in crime, Kevin, there. He's getting ready for the test. What we do here is we make sure that the client's connection is as good as possible. With Mend, we serve a lot of clients in rural areas. We serve clients in Indian reservations. In even more populated areas, a lot of urban clients find out that their connection is limited not by their connection back to the cell tower, but the connection at the cell tower back to the internet service provider. So having the ability to have a really efficient video connection is really critical for care. With the help of our video performance test, we're able to optimize connections for clients all the way down to low 3. Kevin has just joined our enhanced virtual waiting room. You're probably used to other platforms that just tell you to keep waiting, your doctor's on the way. With Mend, we thought we could do that better. Here we've added our own custom content library. This is educational content that's curated to be appropriate for healthcare consumers. And your practice can add your own content at any time. This gives your clients a much better waiting room experience. In a survey of over 15,000 of our patients, the average response was a 4.95 out of 5 for satisfaction with this technology. Ultimately, the point of the enhanced virtual waiting room is to drive down no-shows. Across all platforms, we see a 21-minute wait for virtual appointments. And the more you can do to keep your clients engaged and happy, the less likely they are to get distracted, go do something else, and potentially miss their visit due to technical issues. One thing that's important to understand about the enhanced virtual waiting room is that it's never going to delay client care. As soon as the provider is ready to start the session, the client's going to be pulled immediately into the video visit. So on the right-hand side of the screen on the provider dashboard, we're going to go ahead and start this visit. As you can see, Kevin's now on the big screen. About half of my bald head is on the right-hand side of the screen. And you'll notice as soon as the session started, Kevin dropped out of the enhanced virtual waiting room. Now, I'm going to go ahead and show you some of the video visit features. First off, we have the standard curation tools that you might be used to: mute, unmute, remove user. We can take screenshots, but we can also force refresh, which is a one-click way your providers can troubleshoot a whole myriad of technical problems. Like the joke says, sometimes the easiest way to fix a problem is to turn it off and turn it back on again. And essentially, that's what we're doing with force refresh. No technical skill required. Another thing to point out, both the patient and the provider have access to our Need Help tool at any time. Mend is very committed to providing excellent customer service, and that means no matter who it is, what platform they're using, they're going to be able to chat with our US-based tech team. On average, they respond in 13 seconds, and they resolve the issue in less than 3 minutes. Now, Kevin's going to show you a couple features of our video engine. One, we can automatically zoom in or out of the patient, and two, we can also pop the video out and overlay it on top of your EHR. This is going to give your providers a single screen experience that's not reliant on an expensive integration to achieve. You're no longer stuck by whatever tool the EHR offers. We also offer standard chat and file sharing tools that you might be used to. We offer the ability to share screen. Where things get more interesting with Mend is in our interactive dashboard. We collect a whole lot of metadata about the client and the appointment, and we make it available to both your providers and all the support staff that go with them to get the information you need to run your practice. And this can include things like video performance data, so your tech team can see exactly what's going on. Was the patient having an issue? Was the provider having an issue? And we can even pass this information back to you through integration with your enterprise data warehouse. The patient dashboard has information that's much more useful to the provider. Here you're going to see outstanding assessments, completed assessments. You're going to be able to assign new assessments on the fly. You can even open them up and fill them out with the patient on the screen, so that if you have clients who maybe don't speak English very well, or they have some other cognitive barriers, you're going to be able to help them understand the forms, fill them out with them, collect e-sign compliant digital signatures, and basically go about your practice workflow. If you need to assign a form right here in the visit, all you have to do is click the plus button, and you're going to pull up a list of all the forms in our forms library that you've chosen to take advantage of. You can do a simple search for the form, and in a couple clicks, the patient now has the form that's necessary. Once again, these can be things like screenings, they can be intake packets, financial affidavits, whatever you need them to be. The final tab on the interactive dashboard is going to be the provider's dashboard. This is where the provider is going to be able to see their upcoming and current appointments. They can even text directly with their patients, let them know they're running behind, running early, and these are free-form text messages, so you're not limited to the text we pre-populated for you. You're also going to be able to transfer the appointment to other providers. If you're used to using things like check-in flags, you're going to be able to leverage our transfer queue to put patients in the correct status. So say you have a medical assistant check in a client and then transition them to an RN, who then transitions them to a medical provider. That's not going to be a problem. These are completely configurable based on your practice needs. If you choose to assign to a specific provider, they're going to be invited to join the current session so you can have a warm handoff. If you put them in just a status, the next available provider who is able to process that patient is going to be able to handle it. Once again, the key term here is flexibility. We understand that every practice is unique, and one workflow works well in one practice. It doesn't necessarily work well in another. This is completely customizable. We want to make ourselves fit your needs, not make you fit our workflows. Let's talk about some of the other features available from within the Mend video interface. So first off, we have the ability to mark patients as no-shows. This can be useful within the application, but we can also pass that back to different EHRs depending on their integration capability. We also have our canvas mode. If you'd chosen to upload a, say, x-ray of a broken bone, you could annotate it here. I use it to just draw terrible smiley faces. This time the guy looks a little bit like a pumpkin, which, since it's getting close to Halloween, it's probably a good thing. Let's go ahead and delete them and move on. Now we're going to move on to our in-visit scheduling tool. We have other tools for providers and staff to schedule from a dashboard, but this is what we provide inside of the video visit itself. The nice thing is you can schedule for the patient right here. We can push that back to EHRs via integration, but you can also choose to send the patient a text where they will be able to schedule their own follow-up appointment, leveraging our full patient self-scheduling triage. With Mend, through the settings button, you're going to be able to control your cameras and other peripherals. So say you wanted to be able to use a stethoscope at a remote clinic, we're going to be able to support that workflow. We don't partner with any specific hardware vendor. We're going to support anything that's visible to the browser. Any manufacturer, as long as the browser can see it. And this means it can be a Bluetooth device, it can work on a PC, it can work on an Android, it can work on an Apple device. This is going to give your team maximum flexibility, and we're going to make sure that you can come in under budget. No longer are you tied to a specific vendor for the hardware. We see these devices improving almost daily, and having the ability to move to whatever works best for your practice now, 6 months from now, or a year from now, we see as a very major value. Mend is not going to be the limiting factor in your technology choices. Now let's talk about recording. Recording is something some other platforms offer, but they don't necessarily do it in the most secure and compliant fashion. In the world of HIPAA compliance, we have to make sure that we're keeping that data safe. A recording of a visit is probably some of the most confidential information you might have. The post-COVID realities facing healthcare is that a lot of providers are working from home, and oftentimes they're not using your equipment. So if you give them the ability to record with a telehealth solution, they might be recording to their own devices. That's not how it works with Mend. With Mend, We're going to pass the recording directly to your secure enterprise storage, and your IT team is going to have full control over access and retention policies. Mend doesn't even have access to the recordings. You're going to be covered from whatever compliance requirements you might have. Your team is always going to be in full control, and you can feel confident that your patient's data is protected. Now we're going to move along to one of the coolest things about Mend, and that's how easy it is to bring in additional participants. I'm sure you've all seen the scenario. You have an elderly client who has an adult medical decision maker, or you have separated siblings or a separated family unit that's receiving family therapy, and you need to bring all those people in, and they might not even live in the same state. With Mend, it's as easy as adding their cell phone number or their email and sending them a quick link. They're going to be able to click and immediately join the visit. You can also click, grab the link, and share it through whatever tools you might have. Once again, lots and lots of power at your fingertips, totally customizable. Now, sometimes video is not always going to work. We have the ability to add in participants via audio, and you can add as many audio and video participants as you need to. We recommend keeping it under 15. Say that your patient drops their video session. With Mend, they're your #1 speed dial. All you've got to do is go to our dialer, click their name, and you're going to be able to get them on the phone. We also often see our dialer used for translation services. Here, we've set up language line speed dials for a variety of different languages. You're going to be able to click and get the patient and a translator connected and go ahead and continue your session. As with everything else, lots of power at the fingertips of the provider, less time spent arranging and scheduling, more time spent actually doing the work they went to med school to do. I hope you enjoyed this brief overview. I look forward to answering your questions. Thank you very much.
All right. Thanks, JD, for going over the many different features that the Mend platform has to offer, and that really any worthwhile telehealth and patient engagement platform should be doing these days. On that note, JD, there are many platforms that claim to be a complete digital front door, but few of them actually deliver. So how would you say Mend is able to offer everything a behavioral health organization needs to succeed?
Sure. We already talked about a large chunk of these features, but we'll go ahead and go down the list. The main idea being we support everything necessary for you to have a relationship with that patient from intake, treatment, discharge, and even post-discharge. So you don't have to worry about them ever having to set foot in the office to begin and maintain their episode of care. Now, obviously, the core of our platform is built around our HIPAA compliant telehealth tool. We showed you that already, but we also have appointment notifications and reminders, and that's not only for the video appointments, that's for all your appointments. So you can have one simple automated integrated tool that handles your appointment notifications, reminders. We can even handle cancellations and reschedules for you. Payment capture. If you're going to move your practice online, you need a way to capture payments. That payment capture tool needs to be fully compliant, not only with HIPAA, but also with PCI or payment card industry. And we're going to provide you those tools. Scheduling, mentioned it a little bit earlier. Scheduling is really critical to patient satisfaction nowadays. One of the really great things that came out of the past couple years as people started using more technology is that consumers are getting more choice in how they're actually able to obtain care. And more, they want what's easy. And what's easy for most people is the ability to schedule on their phone, just like they're used to with something like OpenTable. And healthcare practices that can offer that are going to get more and more customers, and particularly the ones with insurance and self-pay, because they want things to be easy. We offer that. But we also offer the tools that the provider needs to make self-scheduling work for the provider. So we integrate with your EHR, let you see, or let the patients actually schedule against the availability in the EHR, and then let you layer on all the business rules that are necessary to make sure that you don't have patients scheduling for inappropriate appointment types, with the wrong providers at the wrong times. And we do it all in a way that's natural and easy for the consumer. So they're not expected to know whether they're there for a high complexity or low complexity in initial or follow up. We put everything in terms that are simple and easy for them to understand. Messaging, SMS and email. Those are two techniques we use to notify patients. We also offer a full secure messaging suite, so you can have entire HIPAA compliant confidential communications with your patients and even perform billable asynchronous visits using that tool. We have dermatology practices doing that. We also have behavioral health practices who are doing those kind of asynchronous workflows. And increasingly, this is a new opportunity for bringing in new revenue, but it's also a way to serve your clients when they might need just a little bit of help outside of business hours. And it's a great tool, keeps you in communication with your clients and your clients protected. Digital intake forms, we covered these a little bit. This is one of the most powerful tools that we offer. Many telehealth products forget completely about all the other things that are necessary to actually get paid for that visit. You have to have the consents on file. You have to have an ROI on place for that patient. You might need to have additional documentation related to the drugs you might be prescribing. And if you don't have a secure and compliant way of getting those forms signed, well, you're stuck doing things like asking your patients to fax back signed forms, mail them back to you, or drop them off at the office. And then that goes back to that same consumerization of healthcare problem where if someone else can do that easily, but you can't, the consumers are going to go where it's easy. So we give you the tools to do that easily. Our digital forms tool is fully e-sign compliant. So it has legal digital signatures in all 50 states. And it's something that can really radically reduce the amount of work that your team has to do and often allows practices to reallocate staff to be more efficient because we can even push those back to the EHR automatically, assign them automatically based on appointment type. You don't have to have staff shoveling around paperwork anymore. And Vlad, any other questions about that? That's kind of our whole solution in a minute.
You did a great job summing it up. In terms of questions, I'll give everyone another minute or two to, if you haven't had the opportunity to put in your question, for sure, put it in. The Zoom has a Q&A box. We'll be able to see it over here. While we get that running, we did want JD for everyone to answer a simple poll question. So our question for today's webinar, does your current telehealth platform include live translation services? JD, we touched on this briefly, but I think it's important to talk about it real quick again. Like, why do you see live translation services as so important, especially as it regards to behavioral health practices and behavioral health patients?
Well, simply not everybody speaks English, and we want to be able to provide care to everybody who is able to access our services, and that means we need to support whatever languages they speak. There's a lot of work being done looking at the social determinants of health right now, trying to figure out how we can improve healthcare for underserved communities. And one of the really common sense, simple ways to do that is just make sure they can be understood. As far as I'm concerned, it's imperative to healthcare providers to make their patients feel like they're listened to and understood, because ultimately, I think as a potential patient or a patient ourselves, that's one of the most important things to us, is just feeling like we're being listened to. So many times in healthcare today, it's easy for people to be reduced to a number on a spreadsheet, but the time they spend with their provider is very valuable time, not only for the provider, but for them. And if they're struggling to be understood, they're not going to be able to, number one, be confident in the service they're getting. The provider's not going to be confident in what they're prescribing as a treatment method. and it's just not going to work out nearly as well. In addition to that, it's also required in many jurisdictions. It's contingent. It is a contingency requirement for a lot of funding sources. So, in addition to being the right thing to do, it's also required in many scenarios.
Here's another good question, JD. We touched on it a little bit earlier, but can you provide some examples of commonly used remote peripherals that MEND supports?
Sure. Stethoscopes are a great example. Otoscopes, microscopes, endoscopes. Basically, anything that can be passed to the browser, MEND can utilize. And the nice thing is you're not tied to a specific vendor. We have clients who are using devices from a myriad of companies. There are vendors on the market right now that want you to use their proprietary software. One of them actually charges more just to stream stethoscope sounds every month than we charge for our video platform. And with MEND, you can go with a solution that's not going to charge you an arm and a leg just to use it. And if that company ever has any problems, you can switch to another vendor without a big hassle, without being stuck in contracts tied to hardware. So lots and lots of options out there.
Another question, JD. If my patients struggle with bandwidth or connection issues, how can MEND help solve for this?
Yeah, absolutely. We've put a lot of effort into making our solution work in low bandwidth scenarios. And we've tested it down all the way to 30K per second connection speeds. So that's 2G, slow 3G cellular speeds. That can cover a lot of folks. And then for people who are in scenarios where there just is no connectivity, we have clients on Indian reservations. We have clients in rural health clinics. A lot of those groups use our kiosk mode. They're able to deploy to community partners where that might be a health department, maybe a church, and they're able to have a private HIPAA compliant kiosk set up where people can go and utilize the technology in a safe, secure place that does have an internet connection. So once again, it's part of our corporate imperative. We want to make sure as many people can use the platform as possible. So we're going to continue not only improving the software so we're more efficient, but also coming up with more workflow solutions so that even in those scenarios where there just is no coverage, we're going to have some option available.
JD, we have time for a couple more questions. Let's start with this one. This was a good one. Does MEND have an app?
We do. We maintain apps for devices that are too old to support the technology we use is WebRTC in the browser. We do recommend that anyone who can leverage the browser version of MEND utilize it because we found it presents less of a barrier to actually obtaining services for the customer. Especially on older devices, app downloads are sometimes problematic. They might not have the space. There might be compatibility issues. Whereas just being able to access our software through the browser, and for the most part, every phone made in the past 5 or so years can access MEND through the browser. It's going to be easier on the patient.
Great. This goes back to similar to the poll. Poll being about live translation services. Are live interpreters HIPAA compliant? This will be the last question for today.
They are if they are used in MEND. I can't speak to other solutions, but if you add them within our platform, they are going to be HIPAA compliant. Everything we do is built from a compliance first standpoint. So we're going to make sure that you're covered from that basis.
Great. With that, I'll close us off first talking about the poll. So JD, 50% answered no, their current telehealth platform does not include live translation services. So good to know. Of course, if there are any additional questions, please reach out to us, mend.com/contact. We appreciate and are glad everyone who was able to join. And please also know that we will be sending off the webinar recording and the deck sometime tomorrow. So be on the lookout for that if you want to share it with anyone. JD, as always, thank you for joining us. And for everyone in the audience, thank you. And we hope to hear from you soon.
Thank you very much.